Osteoarthritis, or OA, is the most common type of arthritis. It affects at least 13% of people living in Canada. That's about 1 in 8 people over the age of 15. Knees, hips, and hands are the joints most often affected. Our body cells that make up tissues are constantly renewing and repairing themselves. Though with OA, our body can't repair joint tissue fast enough. Increasing joint damage usually occurs gradually over a long period of time. OA also affects the joint linings, surrounding ligaments, and muscles. OA is a progressive disease of the whole joint that leads to breakdown of the joint cartilage and the underlying bone. When a joint develops osteoarthritis, the cartilage gradually roughens and becomes thin, so it doesn't work as well to provide a smooth gliding surface or act as a shock absorber. The bone tries to repair itself, resulting in bony spurs at the edge of the joint that can cause pain and limit movement. For example, with OA of the knee and hip, activities like trying to get your socks on can be more difficult and painful. Osteoarthritis can also cause the joint lining to become irritated and produce extra fluid, making your joint look bigger and feel warm, while causing pain as it puts pressure on the ligaments. The ligaments slowly thicken, making the joint stiffen. You may experience stiffness in the morning or after being in one position for too long. Pain and swelling can result in a decreased activity level, further adding to muscle weakness experienced with osteoarthritis. This can make your everyday activities more difficult. You may feel that you can't trust your joint or leg as it gives way due to weakness or pain. A number of factors can contribute to the development of OA, including older age, being female, being overweight or obese, joint injury, repetitive use of joints, muscle weakness, and inactivity. Some factors can be changed to reduce the risk of getting OA and slow its progression. Losing excess weight, strengthening muscles, and being more active have been shown to lessen arthritis pain and improve function. An increasing amount of research supports the effectiveness of activity and exercise as a self-management strategy for OA, as well as many other chronic diseases. Exercise and activity is the magic pill. Activity and exercise can help feed your joints. Cartilage has no blood supply and is mainly nourished by the synovial fluid in your joint. Loading and unloading of the cartilage that happens with weight-bearing activities and resistance exercises pumps the fluid in and out of the cartilage, removing waste material and providing nutrients, keeping it healthy. However, static weight bearing, such as standing for prolonged periods of time without moving, can be detrimental and can make cartilage more vulnerable. Weight bearing itself isn't enough. Activity is important. Activity and exercise can also relieve stiffness, improve strength and energy. Make your everyday activities easier to do with increased energy levels. Limit loss of muscle strength and bone mass with aging that is partly due to inactivity. Improve your balance, decreasing the risk of falls. Help you get a better sleep. Improve your ability to deal with mental health issues such as depression, anxiety, stress, and self-confidence. Help you manage your weight, reducing the load on your joints. Decrease the risk of developing a number of chronic conditions such as heart disease and stroke, lung disease, circulatory problems, type 2 diabetes, high blood pressure, osteoporosis, and the risk of certain cancers such as colon, breast, lung, and endometrial.